Mouth breathing is just there. First of all, it dries out your mouth. So
Yeah.
I've had people come, they're like, Lydia, like I get my cleanings, I'm eating right, I'm doing everything right. And that's why one of the 5 pillars of dental health is habits. And these habits are chronic congestion, mouth breathing, and excessive snacking. So children shouldn't be constantly snacking throughout the day. They need to, they need to rest their bodies so that their digestive system rests. Mouth breathing, they shouldn't be mouth breathing because they're drying out their mouth, they're removing the immunity to their body through their mouth. Okay. And they're not getting properly oxygenated. And when children aren't getting properly oxygenated, they start getting diagnosed with behavioral problems, and they start get like anxiety and depression, and they get on Adderall and antidepressants. And I had this one kid, he was like on 3 types of antidepressants. And I was like, and you could tell he's mouth breathing and he's suffering.
Hey guys, welcome back to the podcast. I'm your host, Nathan Riley. All of my services, holistic OB/GYN services, pregnancy, postpartum support, fertility support, can all be found at belovedholistics.com. You've found your way to my podcast, and I'm so happy you did because I bring on amazing guests every single week. And this guest is no exception, Dr. Leedia Riman. She is a dentist, a biologic dentist out in Beverly Hills, out in California, near where I did all of my training at Kaiser. And she does dentistry in a slightly different way. You've probably heard about the Weston A. Price Foundation. Weston A. Price was a dentist who traveled the world looking at people's teeth, their enamel, the gums, their oral health. And then he started connecting the dots with a person's overall health based on just looking at their mouth. And then he started doing some other cool stuff. He started bringing in diet and lifestyle and all these other things, and found that people who were eating a largely paleo, as we would call it, diet, were actually doing far better, reflected in their mouth as a sign of their overall physical well-being. So what this means is that if we take the entire person's health into account, their diabetes, their stress factors, their blood pressure, all of that, you can tell quite a bit from the mouth. And if we improve the health of the mouth while taking into account the entire person's well-being, we're going to get overall better dental health, but also better cardiovascular disease risk, diabetes risk, etc. And Dr. Riman does this in her practice. So what you'll find in our interview is that Dr. Leedia does not mess around. She spends far more time than most dentists do trying to understand every aspect of a person's environment in order to provide them with the most comprehensive dental care possible, really taking a huge page from Weston A. Price. Dr. Riman also has a course that she just launched. It is really in order to help you as parents out there reverse and prevent cavities in your children. So her course is called Reversing Dental Cavities in Kids. She covers dental health in the home, nutrition, supplementation, habits, and then also gets into really what is dental decay? How can we minimize that through dental care of ourselves and our children? She throws in some bonuses around optimizing a baby's oral health before conceiving, as well as optimizing your baby's health while bottle or breastfeeding. This is a very, very comprehensive course. We'll put a link in the show notes as well as the podcast description. The show notes, by the way, are found at belovedholistics.com/podcast. And I'm super excited. I'm super excited for you to hear from Dr. Riman. There are a couple sponsors that have made this show possible. And if you're interested in supporting the show, one of the best things you can do is support the sponsors. They are in alignment with my brand, so much so that I feel very, very honored to tender their brand and to make you aware of some of the great companies that are doing good work out there. There's a lot of supplements out there. There's a lot of coaching programs. There's a lot of presumed experts on certain topics. I think I've found the best, and the brands that keep the lights on here are very much in alignment with my truly holistic approach to women and men's physiology and their fertility and their childbirth experience. So the first of these brands is BirthFit. BirthFit provides pregnancy and postpartum specific coaching. If you were to go to any gym out there and say, hey, I'm pregnant, I want to have the best birth experience possible, maybe you already are aware that exercise alone leads to less pregnancy complications and an overall more natural, uncomplicated birth, faster postpartum recovery. It's been well documented. BirthFit does this. BirthFit does this specifically for the pregnancy and postpartum periods. And there's not a lot of gyms out there. If you go to the gym and you ask for that type of care, they're going to just pop you into the same program perhaps that a 26-year-old former NCAA basketball player was doing. And maybe they modify it a little bit and they, cave to sort of the pressures of the system that exercise is not safe in pregnancy or whatever. Don't go too intense or whatever else. You need a coach that is trained to do this. BirthFit professionals do this well. I've done their coaching certification. I've gone through their coursework. BirthFit and the team at BirthFit, including the star of the show, Lindsay Cantu, have really dialed this in. So if you want to check out their services, go to birthfit.com, use code BELOVED, and you can save 20% on their postpartum basics program. It's all online, all self-guided. You can also join their B community where you're going to meet like-minded people and get your questions answered, share your insights, learn about diastasis recti, learn about pelvic floor dysfunction, learn from leading thinkers in the field and practitioners in the field, including myself, in regular webinars as a part of the B community. And if you want to become a coach, a BirthFit professional yourself, they have a fall cohort that's starting here just in a few months. You can save $400 at birthfit.com using code BELOVED400. Organifi is also a continuing sponsor of the show. I am caring for the owner, Drew Canoli, and his wife in their current pregnancy, and they have it dialed in. And part of that is because the owner of BirthFit, Drew, has very, very, very thoughtfully blended together some of the highest quality, if not the highest quality, whole food additives to your already lifestyle regimen for you to basically be able to optimize your nutrition at convenience. So I'm going to show you here a couple of these brands. So I start every morning with green. I mix it with Element, I'm not sure how you say it. It's an electrolyte mix. We have that at a discount on my online store, which is at belovedholistics.com/shop. I mix a little packet of their green juice with that. You're going to get tons of phytonutrients. There's chlorella, spirulina, there's ashwagandha. All of these are going to be, I think the purpose that I would advertise is that you're going to start your day off with a little bit of detoxification. Lemon water is great. Green juice is stellar. So in addition, the ashwagandha provides a little bit of a hormetic stress, helping you manage and mitigate stressors, larger stressors in your life. This is a go-to. This is an everyday type of thing for me. Then in the afternoon, I'll move on to the red juice. The red juice is loaded with beets, berries, all sorts of antioxidants and polyphenols. I use this to get a little natural energy boost in the afternoon. It's way better than caffeine, does not disrupt my sleep, but it does give me the benefit of a whole bunch of B vitamins and other phytonutrients in order to maximize my energy when I need to get some extra stuff done in the afternoon. And then lastly, I finish off my night with their gold latte, turmeric, lemon balm, a ton of adaptogenic herbs. There's also some functional mushrooms in here in order for you to get the most restful sleep, to recover optimally, and to wake up not feeling very groggy. I'll put a scoop of this with a scoop of organic full-fat coconut milk, and this is the perfect nightcap. Ditch the wine, grab some gold latte from Organifi. And for a limited time, if you go to Organifi.com/beloved, you'll save 20% on any of their products. But if you get their sunrise to sunset kit, that includes 30 servings of each of these, the gold, the green, and the red. They're also going to throw in 30 servings of their pure blend, which helps with cognition, mental clarity, focus. I'm about to pop some of that as well because I am running down today and I need my brain to be operating on all cylinders in order to provide the type of care that I provide to people. So Organifi.com/beloved, or just use code beloved at checkout. You'll save yourself 20% on this incredible brand. Bioptimizers, also a perennial sponsor of the show. They make a variety of great products, but I'm going to talk about two right now. The first is, let's first kind of unpack what this functional medicine thing is. A lot of people say, I'm a functional medicine practitioner. Maybe they're a nurse practitioner, a doctor, whatever, a chiropractor. They run some labs and then they say, oh, you're deficient in certain things. And then you're supposed to take these extra supplements to bring those levels up. The problem with that approach is there's a good chance that if you're already eating a healthy diet, that you probably have enough of those nutrients going into your GI tract. But if you're not digesting and absorbing them well, then all of that money you're spending on all the supplements in the world is not going to replace an inadequately digesting or a malabsorptive gut. Fortunately, there are some great products out there. When I run stool analyses and I see that, man, there's a lot of fat or protein that isn't broken down in your stools, I know that we need to add some extra enzymes into the intestines to break down proteins, to break down fats, even break down carbohydrates. Bioptimizers makes a product called Masszymes. Masszymes includes a whole bunch of proteases, lipases, amylases, other enzymes in order to get the best bang for your buck when you're eating those high quality foods. So I will tell people take a few capsules of Masszymes with each meal while we further investigate what's going on upstream. It might be a microbiome issue. It might be that you've been taking too many antacids. Fortunately, there's another product called HCL Breakthrough from Bioptimizers. These are the two punch combo that will get you maximally digesting and then absorbing the nutrients from your food. So you take HCL Breakthrough, it adds some stomach acid into the mix. That gets the digestive process going in the stomach. You got to ditch the antacids. You got to wean off of those. Actually, I help people do that quite frequently. Once we get you off those antacids and we add some HCL Breakthrough, the digestive process is going to be firing on all cylinders by the time the food gets into the intestines. That's why we're adding the Masszymes. You're going to get further digestion, better absorption of all of those amino acids, the sugars, the nutrients galore that you're getting from your diet otherwise, like we were just talking about with Organifi. If you can't absorb this stuff, it's not worth it. So if you have any sort of nutrient deficiency, if you have any sort of IBS symptoms, HCL Breakthrough, Masszymes, both available from Bioptimizers. If you go to bioptimizers.com/holisticobgyn, you will save yourself 10% on your purchase of any of their products. They also make a great sleep aid called Sleep Breakthrough, which has a bunch of amino acids and magnesium. It'll get you a really, really restful sleep without feeling the grogginess in the morning. You want to maximize your recovery, maximize the nervous system, especially in its recovery stages throughout the night. And then while you're drinking your gold latte, you just knock down some Sleep Breakthrough and you've got your magic 1-2 punch there in order to get the most restful sleep of your life. This episode is also brought to you by Rosemary Marin. Now, Rosemary is very, very special. Rosemary does something very, very unique. She helps people connect to the souls of their unborn babies. Now, that could mean that you are experiencing recurrent pregnancy losses. You've maybe lost a baby in the uterus. Maybe you lost a child shortly after birth. Maybe you haven't been able to get pregnant, but you feel the spirit of the baby calling, trying to come into the womb. Maybe you're healthy and happily pregnant, but you want to connect to the spirit of your baby before the birth. You want to start to understand them and unpack that relationship a little bit, that bond a little bit before the baby comes earthside. Well, Rosemary Marin, in her coaching program, which is called Soul Connections, she does this virtually or one-on-one. She draws from transpersonal and interpersonal hypnotherapy. She is a doula. She's done a vast array of work within the birthing community, and this is what she does. So reach out to Rosemary at rosemarymarin.com. It's MERAN.com. Connect with her. I don't bring people into my sphere very easily. Every day I get somebody offering to do something unique, and Rosemary really is the real deal. So I really, really want you to try to work with her, see what she has to offer. Go and schedule a call at her website. Again, it's rosemarymarin.com, MERAN. And I am so grateful that we have so many great brands that are in alignment with what we're doing here at the podcast and in my practice. And I feel very fortunate to be able to support them in their work. So if there's something here in one of these brands that you really love, go to their website, use the code, get a discount, try to figure out what is in your control. These brands are offering a lot of opportunity to connect better to physical, mental, emotional, and spiritual well-being. And it lets them know you're listening. Some other ways to support the show. Remember, we are on YouTube. Go to YouTube, subscribe to the channel. You're going to see all of my guests now. They're bright and shiny faces, the essence of what they bring to the table. You'll see that all there. And if something in this episode or any episode captures your attention, really calls to you, share it with your friends. And leave us a 5-star review on Apple Podcasts. It really means quite a bit to the algorithm that dictates what you're seeing and what other conversations people are hearing. All right, without further ado, biologic dentist, practitioner of the Weston A. Price method of caring for the whole human, starting with oral health. Here's Dr. Leedia Riman, biologic dentist in Beverly Hills, California. Well, Nathan Riley here. Thanks for tuning into the Holistic OBGYN podcast. You're probably wondering, why on earth am I interviewing a dentist? We work in two very, very different ends of the body, Dr. Leedia. But I would love for you to share a little bit about why, maybe some one specific example that you shared before we started recording, why these two parts of the body, the female pelvis and the mouth, are so connected. And we'll get into the inflammation and everything later. But tell me about relaxin a little bit. This is quite interesting.
Dentists and gynecologists need to be talking all the time. So that's how I feel.
Or you now have a friend. You have your gynecologist,
yes.
woo-woo
I'm
gynecologist.
grateful. I share all this with my gynecologist. I had two, and one thought I was crazy, and the other one was like, okay, she's starting to open up the things. Relaxin is a hormone that we are so blessed to have released in our body before we give birth, because it relaxes our ligaments to allow for a healthy vaginal delivery without killing you. So we have our teeth are each housed in something called a periodontal ligament, and these ligaments, also all ligaments have relaxin receptors. So relaxin does not discriminate. So when there is a huge influx of relaxin into your body as you prepare to have a child, the receptors around the ligaments around your teeth do get also more elastic and tend to move and start. Women don't notice it usually after their first pregnancy. It's usually after a second or a third pregnancy, and they're like, oh my God, Lydia, I just feel my bites off, something shifted, my teeth are moving, I haven't worn a retainer for so long and my teeth haven't moved, but after I had a couple babies, my teeth are I need braces again or Invisalign again, and it's usually because of the relaxin.
Yeah. Relaxin. Yeah. I remember there being a little bit of controversy as to whether or not relaxin actually was a real thing, or if it was some sort of metabolite of progesterone being cleaved somewhere in the body. But regardless, yeah, without this relaxing of all of the connective tissue, your pelvis doesn't open wide enough to let a whole baby come through. And it's not the first time I've heard about people they're chipping teeth while they're pregnant because their teeth are all shifted around, and not to mention that it's not an isolated system, right? We're going to get into, Weston A. Price's work and how the mouth is actually maybe a reflection of your whole body health. But your microbiome changes, all of these hormones, the various mineral, proportions, everything is shifting in pregnancy. So the way we care for our mouths kind of reflects how we care for ourselves, how we show up in the world, I think, in many ways. So you, compared to a lot of dentists that I grew up with, you would consider yourself a biologic dentist. I found one here, Jack Call, MD, in his or DMD, I suppose, and his associates in Louisville do, I think, a very similar practice that you do, which, relates to, hey, do we need to jump right to an operative repair of root canal? Dr. Jack Call and his associates here in Louisville, they have a similar kind of practice. It's based on the work of Weston A. Price, which is really, really, he was a dentist that traveled the world and really found that there was a lot of connections between where he was seeing some of our even modern day sort of maladies, hypertensive diseases, osteoporosis, gut issues, heart disease, if I already, diabetes, all these sorts of things. And you could actually look at a person's teeth and tell so much about what they were eating and how their metabolism was being driven. So biologic dentists, what is if you were to meet somebody on an elevator, what would you tell them about biologic dentistry and as it compares to the conventional way of doing things?
I would say that I look at teeth last. I talk to the patient. I get information about their lifestyle. I get their information about their diet, what their favorite snack is. What do they sip on throughout the day? How much water do they consume? Do they consume electrolytes? Do they eat meat? What kind of meat? Is it grass-fed? Where do they shop with their regards to what kind of supplements do they take?
You sound like me. It's crazy.
Concept. But you need to know these things to properly help somebody heal and treat a problem. Because I believe I can train a monkey how to do a filling, with all due respect to dentists who take pride in, I mean, I take pride in my restorative work and my fillings and my onlays, and but you can train a robot or a monkey to do that. There's no critical thinking there. You remove the cavity, you fill it in, voila, and you're done. But you need to understand this patient, what they're going through. I ask my women, how many times have they gone through IVF? Women are getting pregnant a lot later in life right now. They're freezing their eggs. How many times have they frozen their eggs? How many miscarriages? How many abortions? I need to see how many hormonal fluctuations this woman has gone through before I look into her mouth. Because a lot of it's going to make sense once I know her. Then once I know, or him, based on, I was drinking this. You're like, I hope it's not Mountain Dew. I'm like, how many Mountain Dews do you drink per day? How much?
She's holding up a spring water. It just looks like it looked like Mountain Dew, and I was kidding because I had a dentist that always had a Mountain Dew, like the red version, on their desk. I was like, God, and the food, like the coloring and the sugar, it was just like, what a
Yes. So I go through all that before I have them open their mouth. Like by the time I ask you to open your mouth, I know you really, really, really well. How do you breathe? What do you mouth breathe? Do you nasal breathe? What's your oral hygiene habits? Like, so that's the differences. Whereas, of course, we take x-rays because we need to diagnose, but it's not just, x-rays, open your mouth, treatment plan, let's do the work. There's a lot more to it. Let's avoid getting that cavity. How did you get it in the first place? So it's a little more intense and comprehensive. And I think it's the standard of care personally, but yeah.
Well, and do you take care of children all the way up through older age?
As I've gotten busier, I've decreased the amount of children that I see, because children do need a lot more time. And I haven't had, I'm dealing with the adults that have severe phobias, and all the adults, like I'd say like 20% of adults love coming to the dentist, they're fine and they're great. And that's because they had a great experience as children. And then 80% of them don't feel the same way. And it's because they had bad experiences as children, or even other sorts of traumas in their life. And I can talk about the connection of traumas and
do that. Yeah, you told me about the live you did with Angie Green. Maybe expound on that a little bit. I think that's pretty interesting.
So I did a live with Angie, who's just become a dear friend. She's just an incredible woman, how like vulnerable, and how she shares so openly with so much vulnerability. And we need more of that. We need people that share real life, especially on Instagram and social media. And she's the one who actually got me to start talking more about this, because I was about to, I was going to be done. Like, I was going to close my Instagram. I had 1,000 followers. And she's like, you have to talk. But we did a live called Open Mouth, Open Vagina. And you're going to connect with this, and that, like, when you watch movies, things are like, birth is portrayed as hell.
Oh, yeah.
Like, it's scary. It's, you're clenching, you're like dying. Like, I didn't have this sort of like relationship with birth with my firstborn. I had a very, very terrible experience. And that's what woke me up to all of this.
Yeah.
But we were talking about how in dentistry, it's a very, very intimate area. Like, it's when you relax your mouth, you can relax your vagina. When, like, her doula, when she was giving birth, she shares this on the live, like she kept on saying, open mouth, your vagina will open. Like, and people are scared to say the word vagina, and they're scared to make those connections. And our mouth is so close to our throat chakra, and we hold so much here. And people are having a hard time speaking up these days. I mean, if there's anything that attests the past 2 years, it's like people, the vocal ones got shut down, and then others like felt like they couldn't speak, and they felt suffocated in various ways. And when I am in your mouth, it just triggers this trauma response, whether it has anything to do with dentistry or not, whether it's sexual abuse, verbal abuse, emotional abuse, anything, any sort of trauma a person has gone through, it just seems to come back up. And it doesn't have to be anything like surgical, or like yesterday I had an amazing woman. I was starting to do an exam, and she just started crying. Like, I barely touched her.
Wow.
It's a very, very, very powerful area of your body. So there is a huge connection, I think, with a woman's aura um, with the femininity, with the ability to just let go and be.
Mm.
There are huge connections, I feel. Women in the birthing process that are unable to speak for themselves and ask for the type of like birth they want and what kind of medications. It's so much more than teeth and dentistry. Yeah, I
Yeah.
can go on and on, but so
So Dr. Price, Weston A. Price, would have been probably very proud, you know, and I don't even, I wonder what his practice may have looked like before he actually went on his sojourn and started making some of these discoveries. I think people tend to, even in medicine, which is dentistry and medicine go hand in hand, at least in our educational process, you get kind of you sort of narrow your focus to one part of the body. In your case, people would say, oh, she just cares about teeth and gums, right? And gynecologist, you look at vaginas and vulvas all day, as if that's like, as if that really matters, this one little piece. Like if you don't look at it as a part of a whole organism, you're missing out on an opportunity here to really provide them with lasting health and vitality. This is just a reflection, as the vulva and the vagina or your pregnancy or placenta is a reflection of the entire organism, which is actually where um, I think we in the West kind of have it wrong. Like the word holism really incorporates not just your physical observations, but also the mental, emotional, and even maybe spiritual aspects of how you show up in the world. And I do think it's reflected. I mean, you know, correct me if I'm wrong, but if you're under an immense amount of stress, something very, very traumatic happens, there's going to be all sorts of things that are happening that are reflected in the mouth, correct?
1000%. I can, the reason someone was like, someone a few like months asked, I get asked this question, like, why do you love teeth and mouth so much? And I'm like, each mouth is a story. Like if you look at a picture of all our teeth in the clinic, you can tell so much by every single story. And then I look at the pictures, my assistant come, they show me the pictures, I take a look at the x-ray after I had met, and I'm like, this, it just makes sense. Things start to make sense. Every once in a while, something is off,
Yeah.
something doesn't make sense. You know, they present as everything is very perfect and dandy. And like I had a patient where, you know, you see her gorgeous top to bottom, you're like, oh my God, she has the most perfect life in the world. And I look at her teeth and it was disaster. And I was like, and there is a zero judgment zone in my clinic. Like, it, you can tell me anything. And I'm like, you can feel free to tell me there's just something not matching up, because I can sit here and fix all this and it'll be great production for my office. And most dentists like won't care. They'll just do the work, make the money, and that's it. But this will keep happening. You will destroy your
Yeah.
mouth over and over and over. And just when I like, and then I've paused for like, I think 20 seconds, there was like a very, like a magical and awkward silence. And she just broke down.
Mm.
And she had suffered from major sexual abuse when she was a child. And I'm like, there
Wow.
you go. So
Yeah.
part of
Yeah.
your dental journey with me, I want to protect the work that I'm going to do. And I don't want you to keep doing this over and over and over. So we had to find like a hypnotherapist for her. And, you know, so it was a very multifactorial. So it's just like, I can't believe my dentist is referring me to see like options for my mental health. And I'm like, this is the root cause of your issues. You don't have cavities. You're literally breaking all your teeth in half almost. And you'll
Never
break porcelain.
considered that. Yeah. I'm like struggling to imagine the psychologist who receives a referral from from a dentist, you know, like it's probably not very common. And that just goes to show like any of us in the healing space, like you're taking care of this entire person and their entire story and the outcomes that they're hoping for. And it may not even be in alignment with who you are or how you show up, but that is what your job is, not to fix the cavity. That's the easy part. I always say, even a
Yeah,
C-section, it's actually
yeah,
really easy. Why did we do this for the fourth time for this poor person? That's the
yeah,
big question. So
yes,
yeah,
yes,
wow, I love that.
yeah.
Well, I'm getting all
So,
razzed here.
yeah, I know. It's like-
So, um, gosh, so I want to have a little like leap of faith here. What are three things that people think about dental care or the mouth that are I don't want to call them myths because sometimes the myths actually serve us, but I think there's a lot of myths around, the teeth and the gums and the tongue and our breathing that are just now kind of emerging. So, what are three things that people really tend to get wrong and that maybe they can start acting on right now in their exploration more of the whole person dentist?
Yeah, such a great question. Um, One huge myth, and I'm going to talk to not only pregnant world, but a lot of women, like old woman's tale. I don't know how you say it in English. You lose a tooth per pregnancy, and with all the surveying I did and all the research, about 65% of pregnant women go through reversible or irreversible dental disease during their pregnancies.
Wow.
And left unchecked, that quickly turns into irreversible, and then unnecessary root canals need to happen, unnecessary extractions, teeth shifting, breaking. So it's a myth that you lose a tooth per pregnancy. Um, Sugar is not the cause for all dental cavities. That's not, of course,
Oh, okay.
we do want to limit our sugar intake for many different reasons, of course, but sugar isn't that end all be all. Um,
Yeah.
uh, and brushing and flossing every day is not going to prevent you from getting dental cavities.
Wow. All right. You did that so effortlessly. This must be how you counsel people almost like on a daily basis is, but I've been brushing and flossing, doc. Why is this happening to me?
Exactly.
Right.
Exactly.
Um, well, we're gonna in the ensuing conversation here, we're gonna kind of get into maybe what a person can do that
Of
would maybe
course.
be respectful of the mouth. But let's put the mouth aside for a second. How do you live your life? Like, why do you know, or how do I want to frame this question? Given everything that you know in your experience with clients, what do you do from a dietary, a sleep, a breathing, maybe even a meditation standpoint in order to take care of yourself, which would be reflected in shiny teeth and non-inflamed gums and everything else?
100%. Such a great question. I obviously have to practice what I preach, and so I woke up when I was pregnant with Julia, my firstborn. She's now 7. She just turned 7. I had hyperemesis gravidarum during that time, and I
Oh,
was
brutal.
vomiting 7 to 14 times a day every day for 8 months.
Oh
So if
my
you had
God.
seen me back then, it was I was a mess. Like I was mentally, physically, and it was I have my personal reasons of why I had to go through that, and I'm grateful for that. But in the process of it, I have a dental implant here that got severely infected during that process. And I was walking around with no front tooth here in Beverly Hills. See, I vomited while I was seeing a patient once.
The hockey
It
fight.
was so it was like one of my darkest moments. And I'm like, why? Like, why is this happening to me? And mind you, you just met my brother very briefly, not properly, but he was cleaning my teeth on a monthly
Wow.
to keep the acidity levels in check that I had in my mouth. And because I wasn't able to brush, I wasn't able to floss, I couldn't wear my guard, I couldn't put anything in my like food, like only like 2 things. And I had to get on Zofran. So it was very, very difficult. Long story short, got through that. And I'm like, it was very hard. So I started surveying women, and so many women went through teeth issues. Like, oh, after my first kid, I needed 4 cavities filled. After, I finished breastfeeding, my tooth broke in half. And
Wow.
I was hearing way too much of this, like way too much of this. So I'm like, why are teeth breaking in half?
Yeah.
Like
Yeah.
it's that's yes, it's stressful. Pregnancy can be stressful. Births in the hospital are very stressful. I got way more pitocin than I wanted, and I didn't know how to advocate for myself at the time. Um, then I started digging into things that have nothing to do with dentistry that lead to optimal dental health, like nutrition. Then I got into Weston A. Price. Like I got super deep into his findings, and it's just incredible. I mean, I'm originally Lebanese. I spent my summers in Lebanon. I grew up in Saudi. So I was always exposed to like organ meats and broths and like
Oh
stuffed
yeah.
stomach.
Yeah.
My grandma would always make these like wild foods and we'd eat them. And I'm like, I have this baby in my hand. I don't know what the hell I'm doing. I don't have the guidance that I need. I didn't even know what a doula was, or like like I don't know what I didn't know what you were doing. And then I just started thinking it's very parallel to cavities. You have demineralization and remineralization. So when you have more demineralization, you get cavity, which is disease. And as women, as me, I had more depletion than repletion. I don't even know if replenishing is a word, but repletion I don't think is a
I
word.
think it
But I
is. It is. It is. I
really,
just looked it up. Yep.
oh my God, love it. Okay, so now I talk to so I started doing bone broths. I started eating liver all the time. I started just focusing on replenishing what I have lost, and mentally I started feeling better. It just things started shifting. The
Was
world
this
started
after pregnancy or was this during?
after. I wish I was wise enough to do that during pregnancy.
Yeah.
That's what I tell a lot of my pregnant moms and people trying to conceive. You gotta clean out. You gotta detox your system, and you gotta fill it in with good stuff. If
Yeah.
you're gonna drink water, you're not gonna use a cup filled with mud. You're gonna clean out the mud, and you're gonna put some like good spring water or life water or whatever type of water that you want to drink. And we're not doing that with our bodies and our spirits. So
Yeah.
I got into the whole food thing big time. I woke up to fluoride. I stopped using fluoride because it's a band-aid effect, and hydroxyapatite is a fluoride replacement. And I started meditating more, even though I can be more consistent with that practice. I started doing parasite cleansing. I started doing saunas. I hired a trainer. I used to be a hardcore athlete, and then I stopped after having a baby because I just like everything shifted. So I I try to truly practice everything that I preach because I feel better. Like when I supplement with magnesium consistently, I'm sleeping better. I do ozone injections in my lymph
Oh,
every
I
now
just
and
heard
then.
about ozone. That's
Oh
interesting. Yeah.
I'm a huge believer. I've been saving teeth from needing root canals for a long time, like for a couple years now by using ozone in my laser. But my lymph is flowing better and I'm sleeping better. And I'm sleeping better, so I'm clenching less and I'm less of a monster in the morning with my kids. So it trickles into everything. It trickles
Yeah.
into your marriage, it trickles into your childbearing years, it trickles into your the way you parent, and it trickles into like how I see my patients. Like
Yeah.
it's yeah. I hope I answered your question
No, I
properly.
mean, you did. This is really just because you brought it up. Every one of my fertility clients, they've been struggling. Nobody's ever looked upstream to figure out what might be happening here, and now they're looking at maybe 15 grand for IVF out of pocket. I get them eating. We do a pretty comprehensive liver detox protocol. We get hydrating well, we get breathing well, we get some mindset and meditation in place, stress management, sleep, all of that, and quite simply, some oysters, some organ meats, some bone broth, fermented cod liver oil, and if you can tolerate eggs, add eggs. And you have now nourished yourself on the physical, mental, emotional, and spiritual levels. And I'm oversimplifying it, but it's these types of things that make such a dramatic difference that it's sort of like I can't not tell you to just do these things. You may never even need to see me again. Just go to your farmer's market and pick up these simple foodstuffs and get some of those other things dialed in. And
Yes.
everything else seems to fall into place. This is really the Weston A. Price kind of way of looking at health. So I'm so glad that you're doing that and that you're practicing what you preach, because I think a lot of us never really learned how to take care of ourselves until our own health starts falling apart.
Yeah.
Um, you brought up hydroxyapatite and fluoride. Let's talk about that. This is a huge thing in my family. My daughter loves Colgate, and it has that minty freshness, and my wife, we both know that the fluoride isn't great, but that there was that Colgate with a Frozen character or something on it. Moana's on this one,
I know.
and fortunately there are some options for kiddos, but for me it's like a hard no to have fluoride in my toothpaste. and perhaps a whole bunch of other ingredients that I can't pronounce on the back of the bottle. So let's talk about fluoride, which is also found, by the way, I think in most water treatment, most
Yeah,
city water. So let's riff on fluoride, and then maybe you can riff on some of these other ingredients like hydroxyapatite or neem oil. There's some other things I'm seeing popping up in a lot of the more natural, dental care products.
100%. So you said something that really hit, like, it is simple. It's because we veered so much
Right.
away from the simplicity
Yeah.
that, like, I find myself saying that, like, it's like, just simple, let's simplify our diets. Like, it is simple. There's some nights where I'm too tired and I'm not going to cook, and my daughters are going to have a piece of sourdough bread with a ton of ghee or grass-fed butter
Yeah.
and a cup of broth. And that's all I need to do. Like, we've made it so hard to be healthy by overcomplicating
Right.
things in our head.
Right.
So it is simple. An oyster, it's so simple. So I'm trying to teach that to my kids, because that's the best thing that we can do. Which takes us to your daughter. There's some there's some things that are gonna sometimes have to give, right? So if she's like emotionally connected to something, right? We have to look at the big picture. For me, fluoridated water is the hardest no ever, because it's going systemic, it's going
Yeah.
to your
Yeah.
brain, it's going everywhere. It's like, to me, it's a tragedy that it still exists, and it just makes me lose trust. And so, like, we're not going to go there, but like, whoever is fluoridating our water, like, what are they getting out of it? Like, why is this toxin being put into our water? Like, are
Yeah,
you
I'll go
gonna
there. What the fuck are we doing? Why are we putting this in our water? Like, let's just
like
stop. Let's just stop doing it. It seems
it's
like a
it's
really nice thing to do.
I don't know. I don't know. Let's stop creating that waste, or like, let's figure out a better place. Because
Yeah,
if you put fluoride, like pure fluoride, on like concrete, it's going to melt the concrete. So, and if someone who's a pro fluoride proponent, like, I have some friends that I can't like discuss this with them. They're like, but it's not in toxic levels in water, but everything is additive.
right.
Like, you get a little toxicity here, and you get a little, and you breathe beautiful Los Angeles air that is very filthy, and then it just and then you go have like a burger, and you don't know where the meat's coming from. So it's so additive. But with
Yeah.
regards to fluoride, for me, the biggest thing I tell moms, especially those who are bottle feeding and they're using, you got to use distilled water. Don't use fluoridated water, because for their little bodies, those level of fluoride, that level of fluoride is going to do. It's been associated with lower IQs, impacts just the entire body and how it flows. And it's research fact. That's what's scary. Like, there's
Yeah.
articles share
Yeah.
this. In toothpaste, I think, just, I would like talk to your daughter and tell her, like, this is why we don't want to do this, because I don't want you consuming this. But you can put very little fluoridated toothpaste and have her. How old is she?
She's only 3.
Oh, bless her heart.
Yeah.
Okay, yeah, so you can make the shift for her.
Frozen.
Bridewell,
Elsa's on the bottle.
I know, I know. So, but you can put very little, or you can just keep the Colgate and get, for example, I use Risewell with my kids, or the wellness brand. For me, hydroxyapatite is very important. After diet and habits comes hydroxyapatite,
No
which is,
kidding. It's that important. Oh, thank God. My wife is gonna love that because I've been fighting
oh
for
my
that.
yeah, if your daughter is eating well and she's not mouth breathing, I'm not gonna lie, there's been nights where I haven't brushed my kids' teeth. I'm too tired. I pass out next to them in bed. I'm not perfect with the brushing and flossing, and I'm a human after all.
Yeah.
So but I'm not worried, because the next day I'll brush them, and I know they're clean, and I know their teeth are strong fundamentally. Like,
Yeah.
I know by the way that I feed them. So it's very important she doesn't swallow that fluoride, but it's just, let's replace it with something else, like the cake batter Risewell toothpaste is great, and my kids love it. It took them a few. It's, when you get rid of the bad stuff, and then you get used to the good stuff, and then you taste a little bit of the bad stuff and you can't stand it. Like, it's like me and perfumes. I used to love perfume. Like, I mean, I grew up in Saudi. Like, everybody gave perfume to each other. Like, perfume was like life, like the best gift
Yeah.
ever. And
Yeah.
now if I smell a whiff of perfume, I feel like I'm nauseous. Like, I'm gonna
Yeah.
vomit.
Yeah.
because I just don't do perfume anymore.
Sure.
So, yeah, fluoride in toothpaste, I would avoid. I personally don't use it at home. I don't use it on my patients, but there is an emotional connection that some patients still like. They feel like, oh, I don't feel like my teeth are clean with the non-fluoridated stuff.
Yeah.
And I'm like,
Yeah.
as long as you're not drinking the water, as long as you're spitting out, there is a little bit of fluoride that is absorbed through your mucosa. But I also don't like to freak people out and to lead with fear. Um, I tell them get in your sauna a little longer, like eat better for a little bit. So there's options for people, but I would not use fluoride in anything that I use with my kids or my patients unless they like demand it. But we don't do fluoride treatments in the office. We don't prescribe fluoridated toothpaste, the high level fluoridated toothpaste. It's just, there's no need for that. It's a band-aid.
Yeah.
Because
Yeah.
true dental health does not need fluoride.
Right. Right. Yeah, it's us trying to do better than nature, and it seems like we kind of missed the mark there. And the research, I've looked at some of the studies. I'm not as probably, as knowledgeable as you are, but I was convinced to pretty easily. Maybe it was my internal bias that I needed to just be like fanned a little bit, but it was like, oh yeah, okay, clearly this fluoride treatments that my dentist offers me every time I'm there, I can feel better about saying no to that. So, um,
100%.
Hey guys, a quick interruption here from this amazing interview. I hope you're enjoying the show. Wanted to tell you very, very briefly about the Born Free Method, which is a program created by Sarah Rosser and I. She and I have become so busy over the past couple years that we have determined we're not able to take every single client that comes our way. So what we decided to do is let's create a group coaching program whereby any couple that has even a glimmer in their eye of wanting to start a family, or maybe they're actively pregnant, or maybe they're postpartum, or you're a birth worker looking to serve other clients and you want to know all of the evidence around interventions, all of the lifestyle modifications that can help to optimize autonomy in childbirth, helping people through counseling around where to have a baby, who's going to attend your birth planning, radical responsibility, the bioethics and informed consents, even topics that others shy away from, COVID, vaccines, ultrasound, everything under the sun that we've ever been asked. We put it together into a self-guided online training program. It starts with 12 months of weekly calls. And while you're going through the content, you can come to the calls with any questions, share your insights in our private community, meet other people. Don't be siloed off. Don't isolate yourself. Embrace community. This is what we're sorely lacking in this world. Sarah and I take an equally balanced approach between the data and the spiritual nature of this transformative period that is childbirth. We focus on the moms and the dads, the whole family unit. We talk about care for the newborn. We talk about psychedelics and cannabis use. There is a whole unit just for the dads. There is so much just in the online course, but then again, you're also getting 12 months of weekly calls where we bring guest speakers. We do some didactics. There's plenty of opportunity for Q&A, so you can get all of your questions answered either by us or one of the many people who've been there and who are on this journey with you in the program. If you want to find out more and learn from Sarah and I, bring us into your care team, go to bornfreemethod.com. Would be happy to see you on an enrollment call. We'll get you booked that day. And we can answer any questions that you have as well. So find us at bornfreemethod.com. I don't want you to miss out on the content, on the calls, on the guided meditations, on the exercises, on the checklist, on the 250 plus citations. Go to bornfreemethod.com. We'll see you there. All right, let's get back now to my conversation. What about oil pulling? Is this a thing that you do?
I love oil pulling for people who can tolerate it. So me personally, I can't tolerate it for longer than 5 minutes. But there's some people, some of my patients love it, and I love it when they use ozonated oil.
Oh,
So yeah, so there's a company called Puro 3, and they have really good quality oils, and they have ozonated coconut oil. And the gist of oil pulling is that you mix a little, you eat, you don't swallow, you put in your mouth like a teaspoon of coconut oil or whatever oil you like, but it's usually
Yep.
coconut oil, I think, or sesame, but it's coconut that I recommend to people. And you swish for about 20 minutes, like 10 to 20 minutes. And that coconut oil is hydrophobic. So it takes up all the hydrophobic disease causing bacteria that causes harm in our gums and our teeth, but it's mostly for your gums. And you spit it out and it removes toxins and it leaches toxins, the bad bacteria, and it's really, really powerful for gum health. For people that just want to have a more Ayurvedic approach to their gum health, and especially if you have gingivitis or periodontitis, this is a really good thing. Obviously, secondary to seeing your dentist to make sure the root cause of your periodontitis and gingivitis is taken care of. And you have like a personalized hygiene protocol. So all my patients have like a personalized hygiene protocol to where like some women, I need to see them every 2 months, and some men, they can come every 6 months. It depends on what's going on inside their mouth, but oil pulling is a great adjunct to oral hygiene protocols for some people.
Do you have to worry about with either of these things? I know a lot of the oils that are out there. Like there's a great company I found called Terra and Co. It's an Ayurvedic blend that has they have hydroxyapatite charcoal toothpaste. I'm gonna ask you about charcoal next.
Mhm.
But they also have an oil pool. It's like a green. It has like neem oil and some other Ayurvedic herbs and whatnot. And it's the same experience as using coconut oil. But I've been
Yes.
thoughtful, would the coconut oil be better as like a from a minimalist standpoint? Because maybe it won't mess with the microbiome, like my oral biome. Is there any concern about that with any of these products?
You know, I wouldn't be concerned about these. Like I just feel like they're just so mild. It's not like an
Yeah.
antibiotic unless you're like
Right.
you're doing it every single day, 4 times a day. And also after we do hygiene, we talk about like probiotic rich foods, prebiotic foods. So when we remove the bad stuff, we want to put the good stuff in. We want the good bacteria. It's life, it's energy, it's we want them there. So there are certain probiotic, like I had this one patient, she had severe MS. She started following the Dr. Terry Wall's protocol.
Mhm.
She's much better now, but I don't know if you're familiar with Terry Wall's, like
Definitely.
just
Yeah. I saw
huge.
her speak and I was blown away. I was like, holy
Oh,
shit, this is
she's
like
incredible. Like she talks and I'm like, oh my God, like I just want to consume all the information.
Mhm.
She's a wealth of like knowledge.
Yeah.
But she does a lot of sauerkraut, a lot of fermented pickled fruit. And this woman, so I test the oral microbiome for my patients and see the levels of what's going on in there. And her levels were incredible. And I'm like, you don't see that very often. And when she told me Terry Walls, I'm like, ah, okay, yeah, he eats tons of
Whole
sauerkraut.
foods. Yeah.
Like with every single meal, she's having like fermented foods.
Yeah.
So it makes a huge difference.
Yeah.
So it's not just the coconut oil. It's That's why I created something called the 5 pillars of dental health that I'll share with you when it does when I
Yeah.
release it June 19th. It's a course for kids and adults in the future, but this one's for kids on how to reverse small dental cavities and halt the progression of larger ones. And nutrition is one of the pillars. Like you need to pay
Of
attention
course.
to what your child is eating. And like my daughter loves pickles. I squeeze in, like I try to sneak in sauerkraut. She doesn't like sauerkraut as much, but let's expose our kids to these things early on. Like let's have them experiment. Let's let them cook in the kitchen with us. Let them clean their teeth with us in the bathroom. Let them clean our teeth. Let them feel empowered. It's truly like let them feel our energy, because when we take care of ourselves, we're taking care of them.
Right. Right. Yeah. I'm so glad to have met you because I really I feel it's so compelling that like if you're out there caring for people, I know I said this, but it bears repeating, like you're really taking care of a person. You're talking to them about how, what their stressors are, what they're eating. I mean, this is so critical. And it like in our reductive kind of materialistic way of viewing the body, there just aren't enough dentists doing this, like talking
Yeah.
about what you're eating. My dentist has never asked me, apart from maybe like, oh, did you have some broccoli earlier? Because there's like a little piece in there. But it wasn't like, wow, you're eating broccoli. Tell me what else you're eating. Like it seems like you have really strong enamel or whatever else. Or you have very weak enamel. Tell me about what you're eating. It seems it's so commonsensical for people like us So I'm really, really hoping that people can maybe even start engaging their dentist in these types of conversations. I want to be respectful of your time, but I've got a couple other really pressing questions. There was a while there that charcoal was this like new thing on the, in the space of, natural dental care. And it was contrasted with a lot of other whitening agents. So maybe you can speak on both whitening agents or how people might get whiter teeth, which is probably going to go back to your pillars anyways. But are there downsides to charcoal? Any, sort of impressions there in your practice?
100%. So there's two ways that you can whiten your teeth and brighten your teeth. There is a chemical way and there's a mechanical way. So mechanical is through abrasion. So every time we do ozone cleanings here, we do a whitening polish with a very fine pumice and hydrogen peroxide, and people see, and sometimes we have a very beautiful thing that blows air with some like very, very fine pumice to remove stains on the teeth. So charcoal is really good at mechanically removing superficial stains.
Yeah.
Okay. But if it's overused, it can cause irreversible abrasion in the teeth. So people started going crazy with charcoal, like really, really crazy. And they were brushing really, really, really hard, and they started getting recession. Or if they had a little bit of recession, it would get worse. Recession is where, like, if this is your gums and this is your tooth, when your gum recedes away from your tooth, and then your root is exposed.
So
okay?
let me just describe that for people who are listening. Yeah. So you just showed your hand and you had your sleeve up, but as the sleeve pulls down and exposes more of your wrist, that's what's happening with your gums around the base of the tooth. I don't know if I maybe use words.
You did so good with that. And then so when your gum falls away from where it should be, our root structure doesn't have the protective enamel. So that can be abraded really, really, really like easily because it doesn't have the protective layer. So if you love charcoal, use it once or twice a week, but can you not be brushing with charcoal every single day because you will see irreversible damage on your teeth. So it will brighten. So I definitely have a charcoal toothpaste, like these brands, they send me a bunch, and I do like to try everybody, and and there's one that I like. It has hydroxyapatite with it, and I'll brush with it like maybe once a week. Then there's a second way of so that gets rid of superficial stains. Then there's a chemical approach to whitening your teeth, and I'm gonna say I am vain with the teeth whitening. I do use the chemical approach. It's not so there's no such thing as non-toxic whitening purely. Like I've tried them all. It's like if I'm going to be dyeing my hair, it is a chemical to dye my hair. Yeah. So it's honestly a choice as to what you want to, invest your toxin level in, if that makes sense. So I live a pretty healthy life. I will bleach my teeth once a year, and I will enjoy it, and I'll maintain it. But it is a chemical approach, and so it's kind of like Clorox. It's a bleach that deposits into the pores of your teeth. And the over-the-counter, so you have over-the-counter and then take-home that I give you like in the office, and then there's in-house bleaching in the office. And to simplify it, it's just percentages and strength. So the over-the-counter is like about 5 to 6%. The take-home is like 10 to 20%, depending on what percentage I give you. And then the one in the office is like 48% or 39%. They shift it from every now and then. So it's very potent. It's chemical that bleach your teeth. That being said, when people are eating a very healthy diet, it's kind of like skin, when you're eating a healthy diet and your enamel is strong and your dentin is strong and you're getting frequent cleanings, you'll end up having whiter teeth because you have stronger teeth. Your enamel is not being it's not being thinned down due to excessive acid in your mouth. We get white teeth as we age because our enamel thins down. And dentin is yellow and enamel is pretty white. It's like a translucent white. So if you notice, little kids have, whiter teeth than like much older people because they have a thicker enamel on them. So if
Oh,
you just take care of your acidity levels in your mouth, you eat a healthy diet, you can maintain the level of white that you have. That's like a common question that I get.
oh, okay. That actually is really helpful. Hmm.
And
Okay.
that's why baking soda rinses are my favorite mouthwashes. I don't believe in any mouthwashes. All that crap like Listerine and Act and Scope, it's BS. It's messing up people's microbiomes. And if they have alcohol in it, it's like even worse. Like it's destroying your microbiome, and it's been linked to like even heart disease and decreasing nitric oxide in the human body. It's really bad stuff. Like I would not use mouthwash, but I love it.
Antiseptic, right? Like you could
Yes,
probably sterilize your
ex-
cleaning instruments in it.
exactly. And you don't need to do that to your mouth. You want you want your good bacteria. So baking soda rinses are my favorite go-to. Like if somebody is more acidic, like had a bulimic patient last week, like she's still in the midst of it. If
Oh,
I sit and start drilling on her teeth, I can't get myself to do that because I need her to decrease the acidity so that my work can last. So
yeah.
that so it's yeah. So baking soda, like 1 teaspoon of baking soda, aluminum-free baking soda, 12 ounces of water. It's just a great thing just to alkalize your mucosa and your mouth. That's what I was doing after vomiting during my pregnancies. So
Wow.
yeah.
I never thought about, I actually didn't even realize aluminum was a problem in baking soda. I never heard of that. So,
Yeah. Yeah.
crap. Now we got to go and investigate that. Thank you. Speaking of aluminum, the mercury fillings thing, maybe just
Yeah.
riff on that. And then the next, I'd love to just have you riff on root canals because I know you have a very different approach to doing that as well.
Yes, yes. So mercury fillings, I mean, obviously, please never get them in this day and age. Just let's just um and I'd rather you keep them in your mouth than have them removed unsafely. So
Yeah.
that's really, really, really important. I'd rather you keep your mercury fillings in your mouth than remove them unsafely. What does safely versus unsafely mean? You need to be protected from the mercury levels during the removal process. So, a few things to look out for, like a biological dentist or even a regular dentist. There are, something you said about like the other dentists and them asking you. I went through a very, very hard time in my childbirth and being a new time first mom, and then my daughter got she had the MMR and varicella vaccine, and 26 days later, we were in the ICU pumping out um, her
So,
lungs.
okay.
So that
I
woke
don't
me
want
up.
to. Yeah. You and I are probably more similar than you think. So,
Yes.
uh,
So that was like, it was like God put an AED on my brain and just reshot. Like I started digging further because I was very trusting of the system.
yeah,
I
yeah,
grew up in a Middle Eastern family, and you just respect your elders and you respect what doctors say, and you're just very, very respectful, and you're a good
yeah,
girl.
yeah.
So, and then, yeah. So, um, when that happened, that's when I woke up. I needed to change something. So when I'm looking at other dentists that haven't had these like levels of like, I mean, my daughter almost died in my hands. So that shakes you up, right? So
Yeah.
that's what shifted my world and how I went from being conventional, even though I was never really fully conventional because it never felt right in my heart and spirit the way they taught us in school. But so mercury fillings, like I placed them in schools. I placed them when I was pregnant because I was working in an HMO clinic in next to the airport here in NLA. And every time I would place them, I don't feel good. I don't feel right. I didn't feel well. Um, so that's how I started getting into it. And so amalgam fillings, which are the silver or black fillings that they say, they're 50% mercury. Mercury is one of the most toxic things on
Mm.
earth. You don't want mercury in your mouth at all. So the way you remove it safely, there's something called a rubber dam. It's a piece of rubber that isolates that tooth. You put pure oxygen into your nose. You cover your hair because that can leach like any little micro mercury particles during the removal process, and you have a huge annoying um, uh, 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 excuse me, oh my god, brain fart.
Hood.
So yeah, a hood, like a huge
Yeah.
suction like right next to your face while you're chunking the mercury. So like we want to remove the mercury in pieces instead of drilling it out. So it should seem intense, the mercury removal process. It's not just a filling where you open your mouth and they take it out and put another filling in. So,
I recall
and I
mercury has
think
a very low boiling point, right? So the heat used to drill it out and everything can actually cause it to vaporize. Is that the concern?
exactly that the
Oh,
heat causes it
wow.
to vaporize, but also just if you're drilling anything out, it's going to vaporize.
Yeah.
It's going to create particles. I don't know the exact boiling point of mercury. I'm going to look that up after our
It's way
conversation.
less than like gold and a lot of the other metals that
Okay,
we talk
yeah,
about. Yeah. I
yeah.
recently looked this up for reasons I won't get into, but
Yeah. And so that's why you also use electric hand pieces that are very, they cut like butter so that they don't provide as much heat. So ask your dentist, are you going to remove this safely? And what does safe look like for you? And then look, I have binders right here. We give everybody binders when we're removing mercury. I use Cellcore. Sorry,
oh yeah,
yeah,
cell core. Yeah, yeah, yeah. I know
they're
that.
great binders and with some chlorophyll, but so it's a process to remove the mercury fillings. I would not keep any in my mouth. Um, I, but there's some people that I get messages all the time on Instagram. Like I'm not in an area where I can see a biological dentist or a dentist that removes them safely, and I tell them please keep them inside your mouth until you're able to, because you will get a huge level of exposure if you remove them unsafely and you swallow any of that mercury.
Yeah.
Yeah.
Gosh, man. I'm sorry this is so rapid fire, but I really have
No.
never met somebody like you. So you
Oh
probably
my
think I'm such
God.
a
I
primary
no,
school dunce.
no, this is so amazing because you're helping me spread this. Like it's what you do is incredible. And I'm like, when I reached out to you, I was just I'm like, God, I wish I had someone like that when I had my baby. Like it
Yeah.
caused such deep trauma in me that like I still it's the postpartum phase. You hear people saying postpartum depression, postpartum anxiety, as if it's like, oh, okay, let's just have a glass of water. It's just become that normal.
Yeah.
And it doesn't have to be that way. And when people practice the way that you do, it isn't that way.
Yeah.
Of course,
Yeah. Yeah.
emergencies, and we just need East to meet West. Like
Yeah.
I'm not dogging on Western medicine and Western dentistry, but it's very sick care oriented, and we need to stop. Like, and we have children, and I don't want a gynecologist treating my daughter the way I was treated in my first birth. Like I just don't want that. Like I don't want her to develop a cavity because she's mouth breathing, and no one ever told me as her mom that she should sleep with her mouth shut, and why. And so
Can
and
you tell me why about the mouth breathing? I suspect that I have
oh
a
my,
little mouth breathing at night sometimes.
yeah, it's mouth breathing is just there. First of all, it dries out your mouth. So
Yeah.
I've had people come, they're like, Lydia, like I get my cleanings, I'm eating right, I'm doing everything right. And that's why one of the 5 pillars of dental health is habits. And these habits are chronic congestion, mouth breathing, and excessive snacking. So children shouldn't be constantly snacking throughout the day. They need to rest their bodies so that their digestive system rests. Mouth breathing, they shouldn't be mouth breathing because they're drying out their mouth, they're removing the immunity to their body through their mouth. Okay. And they're not getting properly oxygenated. And when children aren't getting properly oxygenated, they start getting diagnosed with behavioral problems, and they
Oh,
start get like anxiety and depression, and they get on Adderall and antidepressants. And I had this one kid, he was like on 3 types of antidepressants. And I was like, and you could tell he's mouth breathing and he's suffering. And all these like teachers and his parents are like, you know, not being very kind to him because I'm sure he's acting up and giving them a hard time, but let's see why. But children should be breathing through their nose because that's how you get properly oxygenated. And that is how properly you get vasodilation in your body so that you can absorb even more oxygen and you can protect your mouth. So I mouth tape myself. I mouth tape my kids from time to time, especially after we've been sick or congested. And nasal hygiene is a part of oral hygiene for me and for my kids. If your nose is stuffed, you cannot have good oral hygiene. And that's like one thing that I'm talking so much about is because if you're stuffed, you're going to breathe through your mouth 100%. And then what happens is that as you're breathing through your mouth 100%, your turbinates get inflamed, and then you get even more stuffed because they're not the right size, and it avalanches.
Like
and your microbiome.
positive cycle. Yeah. Feedback cycle.
Exactly.
Yeah.
Exactly.
And by the way, guys, when I say a positive feedback cycle, I don't mean it's a good cycle. I mean that more
Yes.
of it begets more of it, begets more of it, and you just end up with this domino effect. I've seen people mixing those feedback loop things up on Instagram.
Totally. I just want to say one thing. Now I want to give a solution to parents, because a lot of parents are like, oh my God, or even you, like if you're mouth breathing, just so that it's not like all like problems that we're talking about. There's two things that we need to do for our kids or even for ourselves. There's sinus rinses and sinus sprays. Okay. So if you're getting sick and you're not feeling well and you're congested and there's a lot of mucosa in your nose and in your sinuses, I want you to, there's a brand NeilMed sinus rinse. It's like saline packets. You put it in lukewarm water, distilled water. If you ozonate the water, that's an A plus. But even if you don't have an ozonator, that's fine. And literally, you put the saline in through one nose, and it should come out the other. In through one nostril, it should come out the other nostril. So that's when we're sick. And when we're not sick, I love this brand called Ion Biome. It's do you know Dr. Zach Bush?
Yeah.
Love him. Like love him. Love what he stands for. Love what he's about. He has Ion Biome nasal sprays, and I do that for my kids every day in the shower. Just opens them up. I like massage their sinuses, and I make sure that they clear out their nose. I let them pick their nose, get all that gunk out, so that they can sleep well at night.
Oh man. Okay. And the mouth taping, I know there's a whole bunch of brands out there. Is there one that you and your family tend to prefer?
Yes, there are two, depending on, so there's three, but there's two that I really use. The Myotape is my favorite for kids because it's a tape that goes around their cute little mouths and it doesn't like cover the entire mouth. And so there's an adult version and a kid's version. For me, I like Somnifix. I don't mind my whole mouth covered. It makes me feel better and more secure. And a lot of people are like, oh my God, Leedia, like I feel like I'm gonna suffocate if I shut my mouth at night. And I'm like, you're not going to suffocate because you're gonna take that mouth tape up before you suffocate. Like it's not super glue, it's not
Sure.
duct tape. Obviously, don't use duct tape. It's a very mild tape, but I just had an athlete come in and I posted about it a few days ago. She's on the water polo team on the US. She's going to represent us on the US Olympics. And she started mouth taping after she started seeing me, and we put her on a protocol. And she's like, I wake up less fatigued. I have more energy to play. I'm trying to get my whole freaking team to use mouth tape. And I'm happier throughout the day. I'm more rested.
Like, hell of an endorsement. Mouth tape is the brand for the kids. Is that the one you said?
No, it's called Myotape.
Oh, Myotape. Oh, gotcha. So mouth tape, you mean in general? I gotcha.
Yes, mouth tape in general. Yeah. There's some people that like to use like the 3M tape. I wouldn't recommend that. I think that's a little too strong, especially for kids.
Yeah.
And then for adults, like for me and you, I like Somnifix. Especially because you have a it's not going to stick on you around for your
mustache. I end up having to do this. I'm like,
yeah, exactly.
It's certainly not very comfortable. So I'd have to, to get the bigger one.
Try the Somnifix. That'll just for everything. Yeah. But these are like little things that you can do. The nasal spray rinses. I'll send you on Instagram a video of my hairdresser after I told her to do nasal rinsing on her daughter. The amount of gunk that came out is unreal. I need to post. I'm just gonna post it on Instagram. I don't care.
Does it work like a neti pot, or is it a spray?
Yeah. No, it's like a neti pot. It's exactly like a neti pot. But she was like, my daughter has never slept this well in her 5 years of life. Until like we did
parents with kids who can't sleep. We turn to like medications and sedatives and all this crap. It might just be they need to breathe better. They need to be closing their mouth and clearing out their nostrils. They're not just their nostrils, but their airway.
Yeah. Yeah. So.
Oh man, I wanted to get into like some other kind of pediatric stuff, but maybe we can do a part 2 sometime.
Yeah,
really, you've got me so compelled. This is so much fun.
I'm really passionate about the pediatric population because that's where we can make a paradigm shift in the dental world.
Yeah.
And that's why I created the course Reversing Dental Decay for Kids. It launches next month. So I'm happy to send you like the information for that.
Oh,
But
we'll
it
promote the
truly,
hell out of it. Don't worry. Yeah. Yeah, we'll
you're
definitely have
so
that.
sweet. Thank you. It really is the core of dental health.
Yeah.
Like children shouldn't be suffering from dental disease. It's the number one chronic disease. And by the time they're 18, 90% of kids have had a cavity. That's unacceptable. Like that's like that that's just not acceptable. As a mother of two kids, that I don't accept that. We can do better. We're smarter than that. We're better than that. So that's what really drives me for creating this course. I've been up all night for the past like it's been a lot of work, but I'm so excited about it because it dumbs everything down because I need to dumb things down for myself and to simplify things down. Nutrition is simplified, supplements are simplified, habits are simplified, and it's truly the core of health. And I'm sure you can do something the same for your field because like we need to simplify it. We need to talk about like we can't stick to insurance driven dental care that focuses on how much is Nathan worth today and we're going to max you out.
How can we
No
max out that
matter
coding? The fact that we even have to have a billing person in every practice out there should tell us quite a bit. Yeah.
exactly. We don't have a billing practice. We are a fee for service because I do need to pay the bills and I need to, and not everybody, I get it. Not everybody can afford it. Not everybody can fly out here. And that's why I'm creating an online course so
Yeah.
that, and it's very affordable. Like it's less than my exam. Like I want everybody to have access to it because it's so easy to fall in like lifetime access because it's, at different phases of your life, you're ready for different types of
Yeah.
information.
Totally. Totally. I love it.
You may go and start mouth taping and then you'll message me and you're like, oh my God, this worked so well. Like what's next? Like what? So it's a beautiful process. It's challenging, but it's really beautiful. So I thank you for spreading that message, helping me spread that message.
My pleasure. We'll definitely get people, who are listening. We'll definitely get you guys the information that you need. We'll put it in the show notes. Dr. Leedia, I have a list of products here that you've mentioned. I do want to ask you for like, your other favorite products. What's your favorite toothpaste, favorite whatever? Like, is there, oh, by the way, the really slippery floss, is there something wrong with that? Like, does it have like some weird, like non-stick agent, like they put on pans? I'm
Yeah.
just curious.
Yeah, there's like a wax. Some of them have BP. It's like BPA, some wax residue.
Oh,
Like I would not use them.
oh,
Um,
okay. So what's your favorite toothpaste,
but
floss, that type of thing?
But listen, I'd rather you be flossing than not. There's some people that's the only tooth like floss that they can use. So um I love using floss picks
Okay.
because we can use them everywhere. There's two brands that I'll send you on Instagram the links to them.
Okay.
There's one for kids and one for adults. Um, they're more of the sustainable, like they don't use the plastics, but I just don't know if I believe everything in the marketing aspect of things.
Yeah.
I just, yeah, like I post about one and another doctor's like, they do this and this and this and that. For me, it's a string, it's not waxed, and I can put it in between and out of my mouth and I can use it very well and it will do the job from a dental perspective. But I have two that are my favorites that I really love. Um, Risewell has a floss that has hydroxyapatite on it.
Uh,
Um, it's just I can send you the link for that as well.
yeah, definitely
It's
do
just
all of that.
it's very thick, so it turns people off. And I'll send you my entire product guide for my course, my dental
Oh,
reversing
that'd be
dental
great.
cavities
Yeah.
course. So that would be something so amazing because I link like the cavity reversal putty that I recommend, the MI paste the fluoride free MI paste that I recommend, and the ozonated oils and how I put them on the floss, and I actually have videos with me and my kids doing it. So it's not only the products, it's also how you use the products. That's a
Yeah.
huge thing. Um, but I can send you all of that. I'm happy to, and you
Yeah,
can
that'd
just
be
link
great.
below. Yeah,
Great.
because it's super helpful.
And what about if you have a favorite oil pool or if you have a favorite toothpaste? Maybe you can
Yeah,
give two toothpaste because I know
sure.
you probably tried 1,000.
Sure. I've tried so many. like for example, Boca is a brand for someone like your daughter or someone that she says no, she doesn't like. There's someone that loves the minty. I don't like really strong minty. Boca has great flavor. It's a very
Okay.
strong minty and it doesn't have fluoride and plenty of hydroxyapatite. Risewell is milder on the mintiness, so that's what I use. And I've recently started trying Wellness. They don't have any glycerin in their toothpaste. So right now there's a glycerin, no glycerin war in toothpaste. It's pretty, there's always something. And they're saying that glycerin does remove the potency of hydroxyapatite. So I need to do a little more research on that and I need to see what works for me. But one tip, I don't care what toothpaste you're using, as long as it doesn't have fluoride in it and it does have hydroxyapatite in it, after you brush, spit out and don't rinse.
Ah,
Let that hydroxyapatite goodness stay on your teeth.
okay.
That actually helped me a lot with my postpartum sensitivity after I had Joy, my second baby.
Okay. Okay.
Yeah.
And what was the name of that last
Yeah.
brand? We'll put it in the show notes for everybody.
Which one?
Boca,
The Risewell
Risewell, and then there wasn't a third one. Okay.
and Wellness. WLLENESSE. Yeah.
Wellness, kind of like a French way of saying
Let
it.
me see. I think I have it right here. Yeah. Yeah, you can come in. Yeah.
Oh, and it's a great little bottle there too.
Yeah, so this is their dry shampoo. So it's this mom who created all these like non-toxic products because, you know, motherhood changes you.
But he's got to
But
do it.
this is
Yeah.
right. Yeah, it's Wellness, WELLNESSE. Yeah,
Okay.
they just sent me everything that they had. But I'm liking, so they have a charcoal one and a non-charcoal one. I'm liking the non-charcoal one more.
Amazing. Dr. Leedia, thank you for coming on the show. I know you're busy. You're obviously like in the trenches there at work. You probably have a patient waiting for you in a few minutes. So why don't we just wrap up, tell people how they can find you, tell them a little bit more maybe about the course that you're launching, and then we'll wrap it up for the day.
Oh, thank you so much. It's an honor to be here with you. So my office is in Beverly Hills. I work with my brother who practices the exact same way that I do. I got him into the biological world after he saw like the amazingness that I started doing. And but yeah, it's a whole body approach to dental health. We place zircon ceramic implants. We do integrative extractions. We don't just extract and just suture you up, and we clean you out really well. We prevent cavitations, which are areas of the bone that aren't healed properly after extractions. And one thing I just wanted to touch on was we prevent a lot of root canals from happening. So about 75 to 80% of root canals don't really need to be root canals. Only, yeah, 20 to 25% of teeth actually need it because they're like infected, they're cracked, or the cavity is fully at the nerve. But so we do a lot of root canal prevention, but I'm pretty active on Instagram at Dr. Leedia, Leedia. And I take a break from time to time. I just got back from being on break, but after you've listened to all of this, you probably can tell I'm very passionate about children and women during the fertility stage and pregnancy stage, but especially children, because that's where we can really make a huge shift in the world of health. And you can't have a good quality of life and a high standard of just this basic chewing and speaking and smiling and functioning without having a healthy mouth. It's like far beyond just beauty. Like, of course, we want to protect our baby's teeth. There is a confidence aspect. Like when somebody has all these stainless steel crowns when they're young, it does impact them psychologically. And that is so preventable. And that's what I feel like that's one of the reasons why I was put on this earth to, you know, help with that. If I help like a handful of children, I've succeeded. And my goal is to help so many children. And that's why I created Reversing Dental Cavities for Kids. And the adult version will come out later this year. But the power is in us. Like you empower your patients. You're their guide. I'm a guide. I'm not at all and all, like I'm with them on their dental healing journey, but it's not just dental, it's a whole health journey. And I'm one piece of the puzzle. And it's really humbling for me to just be a part of that puzzle and empower my patients I want you to take better care of yourself. And hey, this is what worked for me. and that didn't work for me. Like it's let's put the humanity back into medicine and dentistry, and I
Amen.
think we'll be a lot happier, all of
Yeah.
us.
Aho, that is a really, really powerful message. And I wouldn't have invited you here had I not like scoured your content and realized that you and I are cut from the same cloth. We just are working on the whole person through a very different portal, so to speak.
Yes, yeah,
One portal up here, one portal down here.
yes.
Dr. Leedia, thank you. Thank you so much for your time.
Thank you for having me.